My name is Dr. Anderson. I'm a veterinarian working at the Holistic Pet Care Center and the Best Friends Animal Clinic in Shawnee. We focus on holistic pet care, meaning a little bit of everything. We try to combine the Eastern and Western to give your pet the most optimal health option. So one of the most common questions we get is, how important is dental health to your pet? And this is a big question. There's a potential for a lot of bacterial growth and accumulation, especially when the teeth get really unhealthy. And because the gum tissue is so vascular, that bacteria and tartar and plaque has easy access to the bloodstream. So we get kidney issues, heart issues, liver issues, even bacterial infections in the blood that are all potentially coming from a very diseased mouth. So keeping dental health in good condition is important for the whole health of the body. Is bad breath normal in pets? I think that depends on your definition of bad breath. Obviously, animals' breath is going to not smell the same as human, but if your dog or cat's breath smells foul or sour or like death, these are signs of an underlying disease. But a lot of people think that bad breath just comes from the teeth, and that's a bit of a misconception because bad breath can come from anywhere in the body. It can come from kidney disease, liver disease, heart disease, or even just a diet that doesn't totally agree with your pet. So if your pet is having gas issues or diarrhea issues, we can also see foul breath with that because the body is not processing the food efficiently. So while cleaning the teeth is a good place to start, especially if there's a lot of dental disease, when we clean the teeth, we do have to put your pet under anesthesia. So we're going to run some blood work. We're going to look and see, are the kidneys doing what they should be doing? Is the liver happy? And we're going to talk to you about whether or not the body is processing the food appropriately and other causes for bad breath. One of the biggest complaints that I see is the owner will come in a month or so later and say, I had my pet's teeth cleaned, but it still has bad breath. And that's likely because the origin of the bad breath is not just from the mouth, but from the rest of the body. So ideally, we would like owners to brush their pet's teeth, but this is not always a realistic or possible option. Plaque accumulates every day on our teeth and our pet's teeth, and it's that kind of slimy film. And brushing can remove that before it hardens and turns to tartar, which is the hard calcification that has to be scraped off or scaled off in a dental procedure. So ways that we can help keep plaque from turning into tartar include brushing, but also any sort of abrasive action. So we used to think that eating kibble was a good way to do that, and to some extent it is. And so some of our dental diets have very large kibble, and the idea is that the animal will crunch hard and sort of rub that plaque off. This is the same idea for our dental chews. So greenies, for example, or the veggie dents or some of the other chews, or even some of the rawhide chews. We have to be a little bit careful with these because we want to make sure that the animal is not swallowing pieces that are too big. They need to be chewing them up into small pieces before they swallow them, or with the case of rawhide, sometimes we don't really want them to swallow it at all. But these are good abrasive ways. There are also water additives that can help reduce the bacterial load in the mouth. Whenever we use a water additive, we want to make sure that the dog or cat has the option to drink water that doesn't have the additive. We don't want them to be forced to drink water that maybe doesn't taste good to them. So you want to have a bowl of fresh water next to your bowl of water with additives so that they have the choice. But if they're willing to drink it, it will help reduce the bacterial load in the mouth and some of the plaque accumulation. Not necessarily. Actually, usually no. Dental disease is not usually a deterrent for an otherwise healthy dog to eat or drink. And so we have seen some really bad mouths, but the dogs just keep eating. So owners may think that not eating or being picky is a sign of dental disease, but often there's a sign of more underlying disease process going on there. So we need to look at the whole dog to determine why they're not eating. Even when we have to remove every tooth in an animal's mouth, which does happen unfortunately due to disease, necessary for life, so they will continue to eat as long as the body needs food. So we need to look in the mouth occasionally as owners and obviously as veterinarians to determine how the disease is progressing, because they don't always give us good signs at home. Animals, ideally we would see them and examine the mouths every 6 months or so and potentially do a cleaning yearly. That's kind of average for most pets. But some of our smaller dogs and some of our breeds that have, I would say, poor genetic components to their teeth really need a cleaning every 6 months. And I get a lot of pushback on this from owners, but honestly, in order to keep as many teeth in the mouth as possible, the more frequent the cleaning, the better. The dentists tell us to brush our teeth twice a day and come in every 6 months to a year. We are not brushing our animals' teeth twice a day, most of us anyway, and so a cleaning once a year is kind of the minimum. And then for some pets, they really need to have it more frequently. So February in the veterinary world is considered dental month, but here at Holistic Pet Care and Best Friends Animal Clinic, we consider every month dental month. So bring your pet in so we can take a look and talk about some options and what might be the best path forward for your pet.